46-year-old male, pan addict, came to us in OPD on 5th of February with a complaint of chest pain. Chest pain, according to the patient, started suddenly while he was sitting down. It was localized to a particular point, but it was associated with sweating. He then went to a local hospital, local doctor who referred him to a Qatar hospital where some medication was given and pain was relieved.
This was when?
On 5th of February.
5th February. Yeah, that's the first time he had symptoms.
First time he had symptoms. Before that he was totally normal and has no any other complaint. He visited OPD where ETT was advised and patient went and ETT was done. ETT patient was totally asymptomatic throughout the duration of the ETT, but his DTS score was of 1, so intermediate risk score has been calculated. But
what are the risk factors?
This was just pan addict and his lifestyle is totally sedentary lifestyle. He usually do not walk much.
He's not diabetic.
He's not diabetic. He's not hypertensive. He's not smoker.
Was he ever being checked for these things?
No, sir.
How can you say he's not diabetic?
आपकी
शुगर कोलेस्ट्रॉल चेक हुई है कभी?
शुगर चेक कराया हमने.
कोलेस्ट्रॉल
चेक.
Oh, that's the best mistakes we do. We just focus on symptom and assessment ETT. We need to assess risk factor as well. So he needs lipid profile. But I have seen that there are changes at peak exercise. इसमें जब आप मैक्सिमम जब आपको चलाया था तो कोई तकलीफ हुई थी आपको? खुद चलने के दौरान कोई तकलीफ आई थी? कुछ नहीं तकलीफ हुई. काम क्या करते हैं आप?
काम सर बैठने का काम है, वो आरी का काम होता ना.
ठीक है, लेकिन कोई चलना फिरना ये सब नहीं है आपका. वैसे आम हालत में चलने फिरने के दौरान कोई तकलीफ होती है?
नहीं सर,
कोई तकलीफ नहीं होती है. So these sometimes in ETT you can have false positive changes as well, because apparently his symptoms are not of that of ischemic heart disease, and these changes are at very high workload. So what we can do, we can verify this ECG with MPS. So he needs MPS. That we'll advise, because otherwise every lay person would consider, or a primary physician may consider him a positive ETT and start him cardiac. So I think MPS should be done on this patient. Otherwise should be counseled. Just we have a doubt. He's not confirmed heart disease patient and need lipid profile as well. That's it.
ठीक, आप प्रोफाइल वेट कर लें फिर मैं